Myself Dr. Jim Bruce from the Department of Respiratory Medicine, Narayana Medical College, Nellore. Pneumonia is an inflammatory illness caused by infections like bacteria, viruses and fungi that damages the lung alveoli. The accumulation of the mucus or fluid makes breathing challenging. It is an infectious disease that can be fatal to everyone, particularly young children and adults. Pneumonia is a common respiratory infection affecting approximately 450 million people per year globally. It is the world leading cause of death in children below 5 years of age group. India ranks second in the world deaths by contributing to 26% of the global deaths and 36% of the global burden in Asia. World Pneumonia Day was established in 2009 with the aim of raising awareness about the pneumonia and promoting interventions like to prevent and treat the disease and generating actions to combat the disease. COVID-19 outbreak has increased the total number of instances of respiratory infections that result in death to 6 lakh in 2021, making it the biggest respiratory crisis in the history. Most of the patients with post-COVID organizing pneumonia may recover within a year, but 5 to 25% of them need treatment and further follow-up. Pneumonia can be classified based on the organism causing it, like bacterial, viral or fungal, or based on which setting the person got affected. If the setting is community acquired, then we can call it as community acquired pneumonia, the other being the hospital acquired pneumonia. The commonest thing in the hospital acquired pneumonia is specifically seen in intensive care units as ventilator associated pneumonia. Or if the person who had visited the hospital in the last 48 hours, if he develops pneumonia, then it can be attributed to hospital acquired pneumonia. As we know, pneumonia is an infectious disease. It spreads from one person to another through aerosol. One should maintain a cough hygiene to prevent the spread of disease to a healthy person. Everyone should be aware of the alarming signs of pneumonia like high-grade fever with chills, cough with sputum which may be blood-tinged, and chest pain beyond 5 to 7 days. And this person need to visit the healthcare personnel immediately. Now coming to the most important part, how to prevent the disease. As we all know, prevention is better than cure. For children, we have vaccines like diphtheria, pertussis, meningococcal and Haemophilus influenza B. In adults, we have influenza vaccine which should be taken on yearly basis, following which we have pneumococcal vaccine which is recommended to elderly age group and high risk age groups like chronic renal disease, chronic liver disease, cancer survivor patients, splenectomy patients and patients who are on immunosuppressive drugs. And persons aged above 65 age group should definitely take pneumococcal vaccine regularly. Finally, the coronavirus vaccine which can prevent definitely. And studies has proven that if a person is vaccinated with 2 doses and booster dose has least chance of developing pneumonia. Even though a person is infected, he may get a mild disease and less chance of getting hospitalization. On this day, let's pledge to prevent this deadly yet preventable disease by avoiding the risk factors and promoting vaccinations. We the medical professionals are committed to effective pneumonia prevention and research towards the better treatment modalities and vaccinations. Thank you.